Dehydration, a condition that occurs when the body loses more fluids than it takes in, is often underestimated in its impact on overall well-being. Yet its effects on cardiovascular health can be profound and dangerous, making hydration one of the simplest but most critical lifestyle factors for protecting the heart. Because water is not only vital for maintaining blood volume but also for ensuring smooth circulation and optimal functioning of every organ system. And when fluid levels drop even slightly, the blood becomes thicker and more viscous, forcing the heart to pump harder to push it through the vessels, which raises heart rate and increases strain on the cardiac muscle. And in individuals already living with conditions such as hypertension, coronary artery disease, or heart failure, this additional stress can worsen symptoms, lead to arrhythmias, and in some cases trigger serious events like heart attacks or strokes. In fact, studies have shown that dehydration reduces plasma volume, causing blood pressure to drop initially but simultaneously requiring the body to compensate by releasing stress hormones such as adrenaline and vasopressin, which cause blood vessels to constrict, raising the workload on the heart even more. And this chain reaction is particularly dangerous for elderly patients whose thirst mechanism weakens with age, making them less likely to feel thirsty and therefore more likely to slip into dehydration without realizing it. And for heart patients taking diuretics or blood pressure medications, the risk is doubled, since these drugs increase fluid loss, which is why doctors often emphasize careful hydration management in post-surgical recovery and long-term cardiac care. The signs of dehydration are not always obvious, but common indicators include dry mouth, dizziness, fatigue, dark-colored urine, reduced urination, palpitations, and in more severe cases, confusion or fainting, all of which can signify reduced blood flow to the brain and heart. Yet even before symptoms become dramatic, subtle dehydration can lead to electrolyte imbalances such as low potassium or sodium, which directly disrupt the electrical signals that keep the heart beating regularly, raising the risk of arrhythmias or sudden cardiac arrest. Beyond these acute dangers, chronic mild dehydration has been linked to the progression of atherosclerosis and kidney disease, both of which indirectly burden the heart. And this means that something as basic as failing to drink enough water over weeks and months can quietly accelerate long-term cardiovascular decline. Prevention, fortunately, is simple but requires mindfulness, as hydration needs vary depending on climate, physical activity, body weight, and medical conditions. But on average, most adults should aim for about 2 to 3 liters of fluids per day, with an emphasis on water rather than sugary drinks or excessive caffeine, which can worsen dehydration, while athletes, outdoor workers, and people living in hot or humid environments may require more, and it is especially important for heart patients to spread fluid intake evenly throughout the day to avoid sudden overload that might stress the heart. Because although water is essential, overhydration can also be harmful in conditions such as advanced heart failure, where fluid restriction may be necessary under medical supervision. Highlighting the delicate balance required in personalized hydration strategies, practical tips include starting the day with a glass of water to replenish overnight losses, drinking small amounts consistently rather than waiting for thirst, monitoring urine color as a quick hydration check, eating water-rich foods like fruits and vegetables, and being extra cautious during exercise, travel, or illness when fluid losses may be higher. It is also crucial to educate family members, especially caregivers of elderly individuals or heart patients, about the hidden dangers of dehydration so they can watch for subtle signs, because many cases of dizziness, weakness, or unexplained chest discomfort in older adults are later traced back to inadequate fluid intake. Public health research continues to reinforce the link between hydration and reduced cardiovascular events, with findings showing that people who maintain better hydration status tend to have lower long-term risks of developing high blood pressure, chronic kidney disease, and heart failure, further emphasizing that water is not just a basic need but a preventive medicine in its own right. In summary, dehydration and heart health are deeply interconnected, and ignoring the body's fluid requirements can silently undermine cardiac performance, increase the risk of arrhythmias, blood clots, and heart attacks, and worsen existing cardiovascular conditions, while proper hydration supports healthy circulation, stabilizes blood pressure, optimizes heart function, and strengthens the body's resilience against disease. Meaning that a glass of water is far more powerful than most people realize when it comes to protecting the heart.